to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're tackling a topic that could truly save lives, sepsis. September is Sepsis Awareness Month, and while sepsis has gained more recognition in recent years, there's still so much confusion about what it actually is, how it develops, and most importantly, how to recognize it quickly. Sepsis can come on suddenly and progress rapidly, so knowing the signs and acting fast is absolutely critical. So let's dive in. Joining me today is Christine, a member of our team. Hi, Christine. How's it going?
Hi, Dr. Borelli. I'm doing great. Thank you so much for having me again here. So this sepsis condition sounds, pretty awful, right?
You are right, it is. And, years ago, I was actually involved in steering the Surviving Sepsis campaign to help promote early detection and management of patients with sepsis.
Really, I didn't know that. So what exactly did you do with, that campaign?
Yeah, I did. Well, back it was about 2011. Sepsis was not a commonly identified diagnosis among healthcare professionals. So many people were dying from sepsis, really because it was being detected too late and it wasn't being treated properly. So hospitals were losing money because patients who did survive sepsis were frequently getting readmitted to the hospital, and as a result, insurance companies were penalizing the hospital systems. In addition, it was the diagnosis that had the highest mortality rate associated with it. So it just was a problem, like pretty much throughout the whole healthcare system. A large part of what I did was focused on educating the hospital staff on early detection and then goal directed therapy. And I followed these patients throughout their stay and tracked their outcome. And then, like, the second phase is I went more out into the community and educated the community about sepsis on different occasions. I also worked with like local nursing homes and things like that to sort of raise awareness, as well as like how to detect sepsis early, what signs to look out for, and really also educating like the patient's family members so they knew what to look out for. So it was definitely a lot of work, but we definitely showed great progress and had a lot of improvement in all of our cases.
Oh,
After about a
wow.
year's worth of work. Yep.
Wow, that's incredible, Dr. Borelli. I know they have learned a lot from you. Detecting sepsis early stage can truly be life-saving, right?
Absolutely.
Yeah, that's really great. Can we start with what exactly is sepsis? Because I'm a little confused as to what it actually means. So,
Yeah, good question. So, sepsis is a life threatening condition that happens when the body overreacts to an infection. So, instead of just fighting the infection as normal, the immune system goes into overdrive, causing widespread inflammation. The inflammation can quickly then lead to organ damage and, without immediate treatment, even death.
oh, that sounds, serious. But what kind of infections can actually lead to sepsis?
That's a really good question that a lot of people ask.
Hmm.
So, sepsis isn't limited to just one type of infection, it can develop from many sources. Common ones include urinary tract infections, such as like a bladder infection, pneumonia, maybe a wound like a skin breakdown, or a wound from a surgery, or really various other types of infections as well. Essentially, any infection that isn't controlled has the potential to trigger sepsis in the body.
I got you. We often hear terms like severe sepsis or septic shock. How are those different from just, sepsis?
Yeah, so those are more like severe forms or progressive forms of sepsis. So it's basically, to break it down, severe sepsis is when organ damage starts happening alongside the infection or as a result of the infection. For example, the kidneys, the lungs, or the brain may be affected. Just about any organ can be affected. Septic shock is the most severe form of sepsis. And in septic shock, the blood pressure drops to dangerously low levels and immediate care is needed. Unfortunately, the mortality rate is over 40% in many studies. So it's really, really critical that quick action is taken to make a difference and help the chances of these patients surviving.
Oh, wow. That brings us to recognizing the symptoms, right?
Of course.
How can people tell if someone might have, sepsis?
So there's a nice little acronym for remembering the signs. I know I really like acronyms
Yeah.
because it helps me remember things.
Mm,
The one I like to use, and it's pretty commonly known, is called time. And if you think about it, time is very, very important when we're dealing with the
exactly.
sepsis
Yeah.
condition. So T stands for temperature. So a fever or even a body temperature that's unusually low would qualify for that one. And a lot of times we forget about the low temperature, but if the temperature is lower than normal, that's also a sign. I is for infection, even a suspected infection counts. So if a patient has a symptom of a potential infection or a potential source, then that is an indicator for the infection component of the time acronym. M is for mental decline, so confusion, sleepiness, or difficulty waking. And then E is for extremely ill. So if someone's experiencing severe pain, shortness of breath, or just feeling worse than you ever have. And if you notice a combination of these signs, so like a more than two or more, then it's really time to act fast. One thing that I want to note is also, a patient can go in the hospital with maybe something like a urinary tract infection, and then they develop sepsis while they're in the hospital. So just because they don't come in the hospital with sepsis doesn't mean that they're not going to develop it while they're in there. So it's important to really closely watch them and monitor them, um, you know, even in the hospital stay. Time, if you can remember time, temperature, infection, mental decline, and extremely ill, that'll really help you remember the signs to look out for.
Oh, wow. That's really important. Like, always remember time.
Yes.
So, if someone suspects sepsis in themselves or loved ones, what should they do?
So they should seek immediate medical help and say the words to a medical professional. I'm concerned about sepsis. This alerts the healthcare provider about the urgency of the situation, and early treatment within the first 3 hours can drastically reduce the risk of septic shock and improve survival rates. Treatment usually includes antibiotics and IV fluids, started as soon as possible.
You know what, Dr. Virelli, this has been such an eye-opening conversation for a lot of people. Sepsis can seem like, it comes out of nowhere. You will have like a common symptoms, right? And
Mhm.
you will not realize that it was sepsis, not until you think about like the time method.
Exactly. They can easily be overlooked. Exactly.
Yeah.
Absolutely right.
But knowing the signs and acting quickly really can save lives, right?
That's right. And it's not just about patients, it's also about caregivers and family members and even healthcare team as working together. The more people who understand sepsis, the better prepared we all are. And if you or your loved one is struggling to navigate healthcare challenges like this, a patient advocate can help assist with coordinating care, improving communication, and helping to ensure that things don't get missed while you are navigating your healthcare journey.
Very well said, Dr. Varelli. Well, for anyone looking for help for themselves or for their loved ones and want to know more about how we could help you with sepsis, there are so many ways to reach out to us. You can give us a call at 947-517-8395.
Thank you. Have a great day. I hope that this, conversation has helped our listeners feel more confident as they navigate their healthcare journey. Bye. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.